Hello and welcome to Health Digest. I'm Ukemrik Tokwa and I'm excited to be your host on this beautiful program. If it is your first time of tuning in, I'd like to say a very special welcome to you. It is your one-stop program that brings you health information aimed to keep body, soul and mind all in unison. Hopefully, making you feel great and optimize your health, keeping you living a day longer I'm not God as long as God wants you. So today on the show, we're going to be looking at quite a number of interesting topics. We're going to be looking at the health space, what's happening in the global space and here on the local scene. We're going to be giving you some health information and hopefully a tip here or two when it comes to the health space. Today on the show, we're going to be looking at an interesting topic, and I'll give you those details right after we pay some bills.
Speaking at the handover ceremony of the solar facilities supported by Gavi, the Vaccine Alliance, and UNICEF at the Pool Primary Health Care Center in Abuja, the minister said the intervention in 371 primary health care centers across 17 states and the Federal Capital Territory will ensure reliable electricity supply for vaccine storage and other essential services. He explained that stable power will strengthen vaccine cold chains, improve working conditions for health workers, and support digital connectivity for health data reporting.
Beyond that, it also impacts the community. The solar is not only going to light up the facility, even the neighboring facilities and the neighboring communities will see the benefit of this enhanced light. So it's building the primary healthcare center is really at the center of the community. And we're reaching that by converging effort.
As we celebrate this achievement and we look ahead, continued collaboration is vital to maintain. Also for these facilities, we have to look at ownership, we have to look at maintenance, we have to look at continuous functionality.
The facility has power and light, and this means that at the minimum they won't be able to turn back any patients at night because of the lack of light and visibility. So it's a good example to show how much just 8 kilowatts can change in a health facility.
The executive director of the National Primary Healthcare Development Agency, Muyi Aina, said the project specifically targets communities with high numbers of zero-dose children who have missed routine immunization. He noted that the solar system will help upgrade the affected facilities to level 2 primary healthcare centers with essential infrastructure including power, water, sanitation, medical equipment, and other commodities required for effective service delivery.
In all, we are revitalizing actively over 4,000 PHCs now. Almost 2,600 of those are completed. These sort of solar power systems have been put in almost all of the revitalized, but beyond the ones that are revitalized, there's another 400 or so that have just been given solar power because that's all they need to get to level 2. And all of this, again, for everyone here, can be tracked on the PHC functionality dashboard.
Without lights, we cannot do anything. Without lights, we cannot even be here today. So this is not only for vaccines and immunization, it is indeed a game changer for the health systems.
This energy that has been provided is sufficient to cater for the cold chain systems, is sufficient to cater for all the service delivery points, whether it is ANC, it is OPD, it is sufficient to cater for it. It's also sufficient to cater for night service of the facilities. So whatever the facility needs to run on, these 8 kilowatts inverter systems that have been provided is sufficient to cater for that.
Health authorities say the solarization project is expected to strengthen vaccine storage, improve service delivery, and enhance healthcare access for millions of Nigerians living in underserved communities.
eHealth Africa, a leading health organization globally and in the African space, put up a convergence for stakeholders to meet on the antibacterial resistance stakeholders meeting and community access to effective antibiotics initiative, ComWatch.
We know antibiotic resistance continues to be a challenge to public health, not only in Nigeria but globally. I mean, we heard today that over 40% of burden it's being of people are being impacted on because of AMR, which I mean is antimicrobial resistance, and so we Last year, JAPIGO and eHealth Africa bidded for a grant that was funded by Trinity Challenge UK, and that grant was applied by, they had over 200 applications from over 50 countries, and Nigeria won. And my team and I led that application process, and we won the grant funded by Trinity Challenge to generate data to help with stock control for antibiotics and also substandard and falsified antibiotics.
This preferred solutions for an integrated data-driven technology designed to control stock in real time and detect substandard and falsified antibiotics. It also empowers community, vendors, and stakeholders to combat antimicrobial resistance. It seeks to access inadequate antibiotic stock and the circulation of substandard or falsified antibiotics that undermine effectiveness and accelerated the spread of MAR, ensuring access to safe, quality, assured antibiotics.
Ugwuoke, it's designed to be that easy-to-use solution that helps identify substandard and falsified antibiotics in Nigeria, and also help patent medical vendors and community pharmacies, including Agrovet, to manage their antibiotics stocks as well. So we hope that this solution will be able to increase the kind of data that we need around antibiotics use in Nigeria and help the different regulatory agencies in Nigeria to take decisions around antibiotic use. This particular project is being launched today by the DG of NCDC, and we have the participation of NAFDAC because the entire solution is being built and aligned with the NAFDAC Green Book, which is actually the only recognized government regulatory agency to register all drugs that comes into Nigeria. So it means that what we are using the solution to do is that for every antibiotics we are helping to scan with the solution, that verification is done at the back end with the NAFDAC Green Book. So which means we're having a close working relationship with NAFDAC.
Optimizing their use across 6 pilot states in Nigeria, Kano, Gombe, FCT, Akwa Ibom, Ebonyi, and Ekiti State. ComWatch aligned with strategic objectives of the National Action Plan, which focuses on strengthening procurement and distribution system to help eliminate substandard and falsified antimicrobials. Welcome right back. I did say I was going to give you a very interesting topic. That's correct. We're going to be looking at the importance of digital literacy, especially in the health space. That's where digital literacy in the health space comes in, as well as authorships. Yes, so you can actually fact check, still use your platform, which is the online search engines, but this time you actually get credible information that ensures that you stay living healthier, and these are actually fact-checked and probably also, produced by medical practitioners. But you know what? I'm going to bring in someone that has all the details, and he goes by the name Solomon for a start. And if you know a thing or two about Solomon, wisdom. Get what I mean? All right then. Nice to meet you.
Okay, nice to meet you too.
All right, so you're a man of many hats, so I'm going to let you let us know what hat you're wearing for this program.
Okay, I'm actually the CTO of NTIP. NTIP is a digital platform for books. It stands Nigerian Tertiary Institution Authors Platform. That's what NTIP is all about. I'm the CTO of the organization.
Absolutely amazing. So in a world where digital literacy, technology, AI is now the order of the game, how important, first up, do you think it is for us as humans and as far as our health is concerned, from, a beneficiary, pretty much a human's viewpoint?
Okay, first of all, I just want to make them understand what digital literacy is all about. Digital literacy, in a simple term, it means like knowing how to use the internet and also the digital tools, wisely. So that's what digital literacy is all about. And it's very, very important in the time that we are, looking at, within a second, you have access to a lot of information So how do you now use those information wisely, and then how you use the internet wisely? Basically, that's what digital literacy is all about. Yeah.
Thank you so much for that. So how exactly does digital literacy influence a user or a person's opinion to be able to get credible information when it comes to the health space? And what could be the damages, or what could be the other way around of not getting proper information?
Okay, when you talk about the health, health is very delicate, and then the information you consume matters a lot. So, like, one thing I would like to say is the ability for one to check information correctly, of the person that wrote those information, and also to be able to understand the institution or organization backing those information, not just believing what Google says or not believing. I think that's majorly that. And then what again?
How does it influence the reliability of fact checking when it comes to the health space? How exactly is digital literacy a game changer when it comes to misinformation in the health space?
Yeah, it's actually a game changer. Platform is a digital platform where verified authors publish their books for consumption purpose, for students, for anybody that may really want to, get educated or get content written by professionals. So that's what our platform, helping connecting authors and then readers. That's just the link, the bridge or the link, the gap we're trying to cover.
So you're able to properly accredit the information with the right source, as opposed to just going online and just checking as per anywhere.
Yeah.
How exactly do you think these digital literacy tools can be used to empower the health sector as a whole? Which areas do you think this can help? And then my second question would be in the educational space, because you mentioned students, and if you know, handouts, I don't know if there's still a thing of now, but it's something that used to happen a lot. But if some of these lecturers, especially in the medical space, could be able to translate some of these into digital literacy tools, I think there might be an easier synergy. But I'm not the expert. So how would you bring that setting to the school space? If we were to come to you, how would you ensure the synergy between the lecturers, the students, their information, or what they call handouts, to become digital authors?
About how to bring synergy between the lecturers and then the authors and the student. Majorly what we are doing is we discover a gap that some of the authors, they publish their book or they write their book, and then there is no any